Now, in our fifth and final section of the lecture topic, benign lesions of vulva and vagina, we will talk about the vulval pain syndrome. Pain syndrome is vulvodynia, and we will talk also about the vulval vestibulitis syndrome and what's the approach to the patient which present with the vulval pain syndrome. Vulval pain syndromes, the causes of the vulval pain syndrome is aphthous ulcer, vulval dermatosis, herpes genitalis, pudendal or genitofemoral nerve neuralgia. Also, we have vulvodynia, burning vulva syndrome. Then there is vulvovestibulitis syndrome and referred pain from urethra or vagina, psychological also. These are some causes that can lead to vulval pain syndrome. Aphthous ulcers, in which ulcers are formed in the mouth or in the genital areas, and it can cause very bad pain. Vulval dermatosis, herpes infection, herpes genitalis can cause pain. And then pudendal nerve pain is also nerve neuralgia, cause vulval pain. Vulvodynia is also by the burning vulva syndrome. Then we have some other, it can be from referred pain from the urethra and vagina. Then vulvodynia is a severe, painful, socially debilitating disease where infection, invasive disease, or inflammation have been excluded. So it's important, it's severe, debilitating, painful disease where infection, inflammation, any other invasive disease is excluded, is not present. Characterized by burning over vulva, and usually the treatment is unsatisfactory. Treatment is not, condition is not very responsive to treatment. So treatment by tricyclic antidepressant like amitriptyline is also effective because it's a debilitating condition. Patient is in lot of pain and discomfort. So sometimes antidepressants, they help to bring the patient to little better condition, and they are tried. So 60 milligram per day for 3 to 6 months. Gabapentin is also tried for vulvodynia. Psychosexual counseling, behavior therapy, and also tried. Surgery is not usually required and it's contraindicated. Then vulvovestibulitis syndrome. The other condition is vulval vestibulitis syndrome. These are the Bartholin glands. Bartholin glands present on the side of the vestibule. Here, these are the Bartholin glands. And then the vulvar vestibulitis, as the name show, is the infection or inflammation of the vestibule of the vulva. Is the syndrome of intense sensitivity of skin of posterior vaginal introitus and vestibule, resulting in dyspareunia and pain. So it's as the name shows, it's the condition in which there is inflammation of the vestibule and it causes dyspareunia and discomfort and pain. And it is usually on the physical finding, usually there is swelling or areas of ulcers which are about 1 to 10 small, 3 to 10 millimeters area of punctate inflammation. That's on examination here. And when they are touch, usually demarcated by light touch with the cotton-tipped applicator. So vulval vestibulitis again is a condition in which patient presents with pain and discomfort, present with dyspareunia, and there is inflammation of the vestibule of the vulva, and on examination usually about 1 to 10 small 3 up to 3 to 10 millimeter areas of punctate inflammation are present. Again, vulval vestibulitis syndrome, treatment for this is a sympathetic approach. Improvement of local hygiene is important, and the control of infective agents and allergens is important. Magnified view of the vestibule, if there is inflammation or vestibulitis, there is inflammation of Bartholin gland, and these are punctate erosions or erythematous lesions are present in the vestibule. That's how the vestibulitis syndrome looks like. There is erythema, there are punctate erosions present. And for the diet modification, low oxalate levels are usually effective for the treatment. Psychological tricyclic antidepressants are used. So treatment approaches, sympathetic approach, antidepressant, how to improve the hygiene, diet modification in which low oxalate levels are used. Gabapentin is also effective for vestibulitis syndrome. Biofeedback, and then behavioral treatment. Surgery, if is done, is vestibuloplasty and laser vaporization. Vestibuloplasty is the repair of the vestibule. Next, approach to the patient. Approach to the patient is on the examination if there is cutaneous or mucosal surface disease present. So if the examination is performed and on the examination if there is involvement of mucus and skin, then depending on if it's present, then we do treat abnormal visible condition present in like infections, dermatosis, pre-malignant or malignant conditions. If there is no involvement, usually we go for alternate diagnosis if there is no lesion present on examination. If there is no lesion present and on cotton swab test, patient present with tenderness which of the area which is checked by cotton swab, then we go for yeast culture. If it's positive, then antifungal therapy usually give adequate relief. If it's negative, then we go for other treatment therapies like topical medications, oral medications, sexual counseling. All these treatments should be tried. If there is good relief, then no additional treatment. If there is inadequate relief, then we go to surgery like vestibulectomy. So again, if you summarize it, approach to the patient depends on if the finding shows that patient has the involvement of the skin and mucosa. If there is no involvement of the skin and mucosa, then we go for cotton swab test. And in the cotton swab test, if there is no tenderness present, nothing, then we go for alternate therapy. And if there is tenderness present, then we do yeast culture. If it's positive, we go antifungal. If there is good relief, then That's it. No further treatment is required. If yeast culture is negative and if there is inadequate relief, then we go for other therapies like dietary therapy, we go for behavioral therapy, and then sexual counseling. These are the different treatment options we can try. If there is no relief, surgery is an option also. So that was all about the our topic, benign lesions of the vulva and vagina, in which we talked about different cysts, different ulcers, different conditions like lichen planus, lichen sclerosis, and their treatment and management. So thank you for watching sqadia.com.